Living Well with LDS Hospital.
Welcome back, everybody. We have Lupe Cruz here from LDS Hospital. She is a nurse and a midwife, and September is Ovarian Cancer Awareness Month. We are just learning this. I did not know this, Lupe. Ovarian cancer ranks 5th in cancer deaths among women. That's a high number.
It is. It is.
Are we getting tested? Are we not detecting it soon enough?
So right now, there really isn't a test. We don't have a test for it. Like with cervical cancer, we do pap smears, but there's not a test for this. There are symptoms. We look for symptoms, and they're sort of vague. If you see some of these symptoms, then your provider will order blood tests, scans, those types of things, and we look for certain symptoms in those tests that would lead us to test even further.
Well, it's a startling statistic that 1 in 75 women, I mean, that is a ton of women are going to develop ovarian cancer.
Right.
And you're saying these are kind of vague symptoms to be looking for? What are these symptoms?
There's bloating, feeling pressure, sudden weight loss, feeling full, that fullness feeling, again with the bloating, an urgency of urination.
Gosh, this is tricky because these could definitely be
a lot of things.
So many different things.
Exactly.
And what are some of the, like the risk factors? Like if you have a family member who's obviously had ovarian cancer, that's a huge sign too.
Right, right. So, genetic history, so if you have a family member who's had breast cancer, colorectal cancer, or ovarian cancer, those are reasons that you would want to be examined even more so. There's the gene mutation, the BRCA1 and 2, that is something that is a genetic thing. And if your family has it, if someone in your family has it, that would be a reason to get checked for that.
So a lot of us are thinking we go in hopefully every year, but you get that pap smear. That's for cervical cancer. At that time, can they tell if you're at risk for ovarian cancer?
What we do is we do a pelvic exam. The pelvic exam, when we do that, we look for things like pain. If you're in pain when we do it, or if we feel any masses, then that would alert us to maybe look further.
And that's part of the standard, you know, pap smear, right? Is for them to do the pelvic exam, or do you have
full
to
exam?
You don't
need to ask for that?
No, that should be something that's done by your provider.
But if you have like that gut instinct that maybe there's something more going on, could you ask your OB to test for it?
What happens is if someone continues to complain, you know, I still feel this bloating, I have pain during intercourse, and you know, those kinds of things, the symptoms that we talked about, then we're going to look further. We're going to look further.
Okay. Lupe, do women bring those things up, though? Or are we afraid to talk about them? What are you seeing?
Some do, and it seems like they're doing it more. I kind of poke and prod. I ask. I want women to feel comfortable with me and feel like they're talking to their friend or their sister. And I think, you know, when you're speaking to another woman, it's easier to say, hey, you know, this hurts. Rather than just kind of let it go and, oh, it's just my exam, let's get out of here as soon as we can. But when we bring these kinds of things up, the statistics of ovarian cancer, then that will alert women to say, hey, we do this for a reason. We do the pelvic exam for a reason.
Well, I would think sometimes, I would just think, oh, it's supposed to hurt. It kind of hurts. You know, you never are getting a pelvic exam. It's a once-a-year thing, and that would hurt. But that is something to bring up with your doctor.
Yes, and it should feel, it's uncomfortable, obviously, to have the exam. That's why nobody likes to do it. But it shouldn't be painful.
That's a good distinction.
That is a good distinction. How do people find out more about what you guys do over at LDS Hospital?
If you go to our website, you can look in there, and there's a lot of information there as well.
Yeah, you guys are so good at keeping everyone informed. It's a good conversation to have. Just a little reminder.
Thank you,
Gotta stay on top
for
of
being
it.
here.
You're welcome.